Welcome to this video about understanding breast cancer. Breast cancer is a complex disease that affects millions of people around the world, and it's important to have accurate information to understand it better. In this video, we'll explore what breast cancer is, the different types of breast cancer, risk factors, symptoms, and treatment options. We'll also provide you with some tips on how to reduce your risk of developing breast cancer and answer some common questions people have about the disease. Whether you or someone you know has been diagnosed with breast cancer, or you simply want to learn more about this important topic, this video is for you. So, let's get started and explore the world of breast cancer together. Breast cancer is a type of cancer that develops in the breast tissue. It is one of the most common types of cancer among women, but it can also occur in men. Breast cancer can start in different parts of the breast, such as the ducts that carry milk to the nipple or the lobules that produce milk. There are several types of breast cancer, with the most common being invasive ductal carcinoma, which means that the cancer cells have spread beyond the ducts into surrounding breast tissue. Other types of breast cancer include invasive lobular carcinoma, which begins in the lobules, as well as less common types like inflammatory breast cancer and Paget's disease of the breast. Breast cancer symptoms can vary from person to person, and not all individuals with breast cancer will experience symptoms. However, common signs and symptoms of breast cancer can include a lump or thickening in the breast or underarm area, a change in breast size or shape, swelling or redness of the breast, skin dimpling or puckering, nipple inversion turning inward or discharge, changes in the texture or appearance of the skin on the breast, such as ridges, bumps, or scaliness, pain or tenderness in the breast or nipple. It is important to note that many of these symptoms can also be caused by conditions other than breast cancer, such as cysts or benign, non-cancerous tumors. However, if you notice any of these symptoms, it is important to see a healthcare provider for evaluation and testing. In addition to these symptoms, routine breast cancer screening, such as mammograms and clinical breast exams, can help detect breast cancer before symptoms develop. It is recommended that women receive regular mammograms starting at age 50, or earlier if they have certain risk factors. Breast self-exams can also be useful in detecting any changes in the breast tissue. The exact causes of breast cancer are not fully understood, but researchers believe that it is likely due to a combination of genetic, hormonal, and environmental factors. Some known risk factors for breast cancer include age. The risk of breast cancer increases as a person gets older. Gender. Breast cancer is more common in women than in men. Family history. Having a close relative, such as a mother or sister, who has had breast cancer can increase the risk of developing the disease. Inherited gene mutations. Inherited mutations in the BRCA1 or BRCA2 genes can increase the risk of developing breast cancer. Hormonal factors. Exposure to estrogen and progesterone, either naturally or through hormone replacement therapy, can increase the risk of breast cancer. Alcohol consumption. Drinking alcohol, especially in excess, can increase the risk of breast cancer. Obesity. Being overweight or obese can increase the risk of breast cancer, especially in postmenopausal women. Radiation exposure. Previous radiation therapy to the chest area, such as for Hodgkin's lymphoma, can increase the risk of breast cancer. It is important to note that having one or more of these risk factors does not necessarily mean that a person will develop breast cancer. Similarly, not having any of these risk factors does not guarantee that a person will not develop breast cancer. However, understanding these risk factors can help individuals make lifestyle choices that may help reduce their risk of developing the disease. Inherited breast cancer accounts for a small percentage of all breast cancer cases, but it can be an important factor for some individuals and families. Inherited breast cancer is caused by changes, or mutations, in certain genes that are passed down from one generation to the next. The two most well-known genes associated with inherited breast cancer are BRCA1 and BRCA2, but there are other genes that can also increase the risk of developing breast cancer. Individuals who have inherited mutations in BRCA1 or BRCA2 have a significantly increased risk of developing breast cancer, as well as other types of cancer such as ovarian and pancreatic cancer. In fact, women with a BRCA1 or BRCA2 mutation have up to an 80% lifetime risk of developing breast cancer, compared to the average woman's lifetime risk of around 12%. Inherited breast cancer usually affects younger individuals and can occur in both women and men. Family history can be an important clue that a person may have inherited a mutation in a breast cancer gene. Individuals who have a close relative, such as a mother or sister, with breast cancer before the age of 50 or ovarian cancer at any age may benefit from genetic counseling and testing to determine if they have inherited a mutation in a breast cancer gene. There are several options available for individuals who are found to have an inherited risk of breast cancer, including increased surveillance and screening, prophylactic surgery, removing the breasts or ovaries before cancer develops, and/or chemoprevention, using medication to lower the risk of developing cancer. It is important to work closely with a healthcare provider and genetic counselor to develop a personalized risk management plan. There are several risk factors that can increase a person's likelihood of developing breast cancer. Some of the most well-known risk factors include gender. Women are more likely than men to develop breast cancer. Age. The risk of breast cancer increases as a person gets older. Family history. Having a close relative, such as a mother or sister, who has had breast cancer can increase the risk of developing the disease. Inherited gene mutations. Inherited mutations in the BRCA1 or BRCA2 genes can increase the risk of developing breast cancer. Hormonal factors. Exposure to estrogen and progesterone, either naturally or through hormone replacement therapy, can increase the risk of breast cancer. Alcohol consumption. Drinking alcohol, especially in excess, can increase the risk of breast cancer. Obesity. Being overweight or obese can increase the risk of breast cancer, especially in postmenopausal women. Radiation exposure. Previous radiation therapy to the chest area, such as for Hodgkin's lymphoma, can increase the risk of breast cancer. It is important to note that having one or more of these risk factors does not necessarily mean that a person will develop breast cancer. Similarly, not having any of these risk factors does not guarantee that a person will not develop breast cancer. Additionally, there may be other risk factors not mentioned here that could contribute to a person's likelihood of developing breast cancer. It is always a good idea to talk to a healthcare provider about personal risk factors and any concerns about breast cancer. Women with an average risk of breast cancer can take steps to help reduce their risk of developing the disease. Some of the most effective strategies include maintaining a healthy weight. Being overweight or obese can increase the risk of breast cancer, particularly in postmenopausal women. Maintaining a healthy weight through a balanced diet and regular exercise can help reduce this risk. Regular exercise. Engaging in regular physical activity has been shown to help reduce the risk of breast cancer. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Limiting alcohol consumption. Drinking alcohol, particularly in excess, can increase the risk of breast cancer. Women should aim to limit their alcohol consumption to no more than 1 drink per day. Breastfeeding. Breastfeeding for at least several months has been shown to help reduce the risk of breast cancer. Regular screening. While screening does not prevent breast cancer, it can help detect the disease early when it is most treatable. Women should talk to their healthcare provider about when to start and how often to have a mammogram. Avoiding hormone replacement therapy, HRT. Using hormone replacement therapy for menopause symptoms can increase the risk of breast cancer. Women should discuss the risks and benefits of HRT with their healthcare provider. It is important to note that these strategies cannot completely eliminate the risk of developing breast cancer, but they can help reduce the risk. It is also important for women to talk to their healthcare provider about their personal risk factors and develop a personalized plan for breast cancer risk reduction. Women who have a high risk of developing breast cancer, such as those with a strong family history or who have inherited gene mutations, may need more intensive risk reduction strategies. Some options for high-risk women include increased surveillance. Women at high risk of breast cancer may benefit from more frequent and/or earlier mammograms or other imaging tests, such as breast MRI. Chemoprevention. Certain medications, such as tamoxifen or raloxifene, can be used to help reduce the risk of breast cancer in high-risk women. These medications can have side effects, so women should discuss the risks and benefits with their healthcare provider. Prophylactic surgery. For women at very high risk of breast cancer, prophylactic surgery, removal of one or both breasts, may be an option. This can significantly reduce the risk of developing breast cancer, but it is a major decision and should be carefully considered in consultation with a healthcare provider. Lifestyle changes. Women at high risk of breast cancer can also benefit from making lifestyle changes to help reduce their risk. This can include maintaining a healthy weight, getting regular exercise, limiting alcohol consumption, and breastfeeding. Genetic counseling and testing. Women who have a strong family history of breast cancer or who are known to have inherited gene mutations can benefit from genetic counseling and testing. This can help determine the individual's risk of developing breast cancer and guide personalized risk reduction strategies. It is important for high-risk women to work closely with their healthcare provider and develop a personalized plan for breast cancer risk reduction. Regular monitoring and follow-up can also help ensure that any changes in risk are identified and addressed promptly.